Welcome back to our Alzheimer's and Dementia training series. Today we'll be tackling an important and sensitive topic: restraints, prevention, and management. Because true dementia care isn't about control, it's about safety, respect, and preserving the patient's dignity wherever possible. What are restraints? Restraints are any method, physical, chemical, or environmental, that limits a person's freedom of movement or normal access to their own body. Common types include physical restraints like wrist ties, lap belts, and bed rails. Chemical restraints, which are medications given solely to sedate or control behavior. And environmental restraints, such as locked areas or blocked exits without therapeutic purpose. Restraints should only be used as a last resort, never for staff convenience or punishment. Why restraints should be prevented? Restraints can cause physical injuries such as skin tears, fractures, and even strangulation. They can also lead to psychological harm, including fear, agitation, and depression. Moreover, they can result in a loss of trust between patients and caregivers, and an increased risk of death in frail elderly populations. Restraints don't just restrict the body, they restrict freedom, dignity, and quality of life. How to prevent the need for restraints? First, understand the behavior's root cause. Is the patient in pain, hungry, needing the bathroom? Behaviors are often ways to communicate unmet needs. Next, create a safe, supportive environment. Lower beds and use fall mats. Use alarms or close observation instead of barriers. Provide familiar objects and soothing sensory activities. Then communicate and redirect. Offer choices and positive distraction. Calmly reorient patients who are confused or agitated. Use music, conversation, or a simple activity to reduce distress. Finally, individualize the care plan. Personalize routines based on the patient's life story, preferences, and rhythms. Involve families to help identify calming strategies. When restraints must be used, only under strict protocols. If a patient is an immediate danger to themselves or others and all alternatives have failed, a physician's order is required. Continuous monitoring must be done. The restraint must be removed as soon as it's no longer necessary. Documentation must be clear, complete, and updated regularly. Our goal is restraint-free care whenever possible. Every patient living with dementia deserves to feel safe, not trapped. By understanding behavior, offering alternatives, and responding with empathy, we can create an environment where restraints are rarely, if ever, needed. Have you used a creative alternative to avoid restraints in dementia care? Share your ideas below. We're stronger when we learn together. Like this video? Give it a thumbs up, and subscribe to continue through our hand-in-hand dementia training series.